Why should you see a chiropractor? What can a chiropractor do that you can't do yourself? Well, my name is Dr. Story. I've been a chiropractor for over 23 years, and I'm going to give you realistic advice based on my experience. Now, on this channel, I give a lot of free health advice. This is advice that I give to my patients, certain exercises, certain stretches. But the reality is, once you know what to do, you really don't need me anymore. If I give you an exercise and that's the only thing that you need, why would you come in and pay for that? Why not just go on the internet and go on YouTube and figure this out yourself? Well, first of all, sometimes it's a little difficult to figure out. But why see a chiropractor? Why do patients need to see a chiropractor when if we just gave them a bunch of exercises, wouldn't that cure everything? Well, the answer is no. I see chiropractic much in the way that we see dentists. We need dentists. You should see a dentist. Now, that doesn't mean everybody sees a dentist, but if you're not seeing a dentist, you should. Why? Because the dentist can do things for you that you cannot do yourself. Now, sure, you should brush your teeth, you should floss, but here's how dentistry works. Dentistry can do things and clean your teeth better than you can do yourself. The same thing is with chiropractic. With chiropractic, I can show you how to do exercise. I can show you how to stretch. That's analogous to the brushing the teeth and the flossing. But why should you still see me? The answer is because I can do things to the spinal joints and the joints of your extremities that you cannot do yourself. It's literally impossible. So when you look at a spine, each individual bone should have movement. These movements are bending forward, bending backwards, bending to the side, and rotating, as well as traction. So what I do as a chiropractor is I look for areas where the spinal joints have lost mobility. Once the spinal joints have lost their mobility, then a number of cascading events occurs which causes further stiffening, muscle spasms, pinched nerves, degeneration of the cartilage, degeneration of the joints, alterations in the posture. That's a bad list. So exercises are like brushing your teeth and flossing to your teeth. What I need to do is exactly what the dentist does, to analyze specifically for these small problems that will eventually become big ones. Just as a dental cavity can become a big thing and eventually need a root canal, the same thing with these alterations of movement in our spine. We call them misalignments. But it's not something where the bone actually misaligned over here and we put it back. It's a problem with motion, and that's how we analyze this. So a good chiropractor will take their fingers and press on the spine and look for areas where there's a discrepancy from one side to the other in terms of motion. That's how we look for misalignments. By correcting them, we reverse all those things that I just mentioned. So just as in dentistry, some people wait until they actually are in so much pain that they end up needing a root canal. Sometimes I feel that way as a chiropractor, that people will try to not see me until the pain is so bad that we have to try to reverse a lot of damage. It's better to go to a chiropractor as a preventative model, just as you would go to a dentist as a preventative model. So if you thought this video was interesting, give me a thumbs up, subscribe to my channel. If you have any questions at all, ask in the comment section below, and I'd be happy to answer them for you.